The most common question I get from people is, well, what is functional medicine? And functional medicine really is medicine for the 21st century. The foundation of it is conventional medicine, conventional Western medicine, and they've taken complementary medicine, integrative medicine, different alternative modalities, and they've really just sort of melded it all into one. The whole purpose of it really is to give the provider an enhanced toolbox. I have more options for my patients. They're not limited to just drugs and surgery. Conventional medicine is a piece of functional medicine, but functional medicine is much more patient-centered. If a certain treatment does certain things for 50,000 people, that's fantastic, but you could be the 50,001st person and it might be different. So we treat every single case uniquely. The other difference really is that we put a lot of focus on the gut and gut health. We don't have that siloed approach where there's, if you're a heart doctor, you take care of the heart, and if you're a nerve doctor, you take care of the nerves. It may be fantastic if the body really worked that way, but it doesn't. I mean, everything works in conjunction together. And central to all that actually is the gut. Because the gut processes nutrition, our approach is a very nutritionally based approach. We have various diet plans. I call them diet plans. They're not necessarily diets to lose weight. They're more diet plans just as far as following a way of eating. I got into medicine actually when I was a teenager. I was very interested in it. Started off as a phlebotomist, finished medical school, started my practice, primary care internal medicine practice. So I was actively looking for something different to make a difference with the patients, to get to their root cause of their problem. In 2010, I had a son who was diagnosed with autism. That's what really pushed me into this, because I took him to various conventional Western doctors, developmental pediatricians, and they all pretty much told me the same thing. There's nothing we can do for him. So I did my own research, and through doing that, I actually found a variety of treatments for my son. He's a lot better now. And I actually found a way of applying this holistic thinking to it, an actual toolkit that I could apply. And then once I started doing that, I mean, frankly, I couldn't go back to practicing the old way of medicine. Usually the patient has the answer. My job is to tease that answer out of the patient and put it into a context that we can both work with and get some sort of actionable plan out of it. That's what we really need to do.